Assalamu alaikum guys, we're going to be talking today about parathyroid hormone. So parathyroid hormone is actually present behind the thyroid gland. So this is superior and inferior parathyroid glands, which is going to be produced it is going to produce parathyroid hormone, which is mainly produced by the chief cells of it. So now parathyroid hormone is going to mainly act on three organs: kidney, bones. This is the direct effect of it. Indirect effect is going to be through vitamin D on the intestines. Okay, so now parathyroid hormone is going to be released and it is going to act on kidney. It is going to stimulate the activity of 1-alpha hydroxylase, which is going to convert D2 into D3, which is the activated form. Now it is also going to act on bones, which is going to increase the resorption by activating the osteoclast cells. It is going to increase calcium and phosphate level in the serum and the blood. Intestine is also going to be increasing the absorption of calcium and phosphate through vitamin D. So that's the indirect effect of the parathyroid hormone. Now direct effect is going to be on kidney, as we have already mentioned, and it is also going to increase the reabsorption of calcium. We are distal covulated tubules, so you have to remember CD. And then phosphate, it is going to decrease the reabsorption of phosphate through proximal covulated tubules. So just remember it by P3. Parathyroid hormone is going to act on proximal covulated tubule to decrease the reabsorption of phosphate. So these are the 3 P's for you. Okay, so that's how I'm going to remember this. Now also parathyroid hormone level is going to be increased when the calcium level is going to drop in the serum and phosphate level is going to increase in the serum. Now parathyroid hormone is going to, the effect of parathyroid hormone is going to increase calcium level, decreasing phosphate level and increasing the urine phosphate level. Why? Because it is going to decrease the reabsorption of phosphate, and urine cyclic AMP level is going to increase via phosphate. So growth hormone acted through what? It was the JAK-STAT pathway. Parathyroid hormone is going to be through the adenylyl cyclase pathway. Rank L is the receptor activated of NF-κB ligand secreted by osteoblast cells and osteocytes, binds to the rank receptor on osteoclast. So now there's a receptor of rank on which rank ligand is going to bind, which is mainly present on osteoblast cells. So the precursor to stimulate osteoclast cells. What happens is parathyroid hormone is going to what it is going to do is that it is going to stimulate osteoblast cells to bind onto the rank receptors, which has a rank L ligand. Now osteoclast cells are going to get activated, leading to bone resorption. Parathyroid hormone, phosphate trashing hormone. This means that increasing the excretion of phosphate in the urine. Parathyroid related peptide functions like parathyroid hormone and is commonly increased in malignancies. Remember that squamous cell carcinoma and renal cell carcinoma, they both are going to release parathyroid hormone like related peptide. This is going to be the squamous cell one. So it is very, very important. Two carcinomas, squamous cell carcinoma of lung and the renal cell carcinoma of kidney. They're going to increase the production of parathyroid hormone related peptide. It is going to act on kidney, bones, and intestine. So if they're going to be weak bones, kidneys are going to get affected. It's because of that. How is parathyroid hormone regulated? So what happens is that low serum magnesium level, when it is slightly decreased, it is going to stimulate the production of parathyroid hormone. Increase in phosphate, we want to get rid of phosphate. That's why parathyroid hormone secretion is increased. Decrease in serum calcium level is also going to increase the parathyroid hormone secretion. But when there's excessive decrease in magnesium ion level, it is going to decrease the parathyroid hormone. So it basically varies. Common causes of decrease in magnesium is going to include diarrhea, aminoglycosides, diuretic, alcohol use disorder. So this was it for parathyroid hormone. You just have to remember this. This is very high yield, and the action of parathyroid hormone on kidney through vitamin D, and then on kidney itself, distal covulated and proximal covulated. So you need to know phosphate through proximal covulated and calcium for distal covulated tubule.